Just set it up?
Yeah.
For the ground or like on the... Excuse me. You're in the way. Okay, go up. Okay. Walty. Oh. Okay. My name's Lisa. I'm one of the veterinary technicians at the Animal Hospital of High Park, and this is Buddy. He is my 14-year-old senior dog.
And I'm Karen Regan. I am a veterinarian here at the Animal Hospital of High Park. And this is Walter, who I've had, I think he was 6 years old, and we've had him for 8 years, and he's probably about 14 to 16 now. We're not even really sure how old he is.
He was not using his certain limbs, like he would weight bear on different limbs, or he had a lot of struggle with some soreness in his front limbs, and he was falling down the stairs quite a lot, so that was a concern.
The hardest part with him, with Walty, is that his cognitive decline over time, because it's very hard to watch one of your best friends kind of change mentally, and any way you want to try and make him happy throughout the day.
They're less active, but it's more so of they're reluctant to be active, or there's some limping. Sometimes you'll notice them doing like a little head bob when they're walking, so it kind of shows that they're a little bit uncomfortable. Sometimes you will find that your pet will have a hard time getting up from like a laying position or jumping into cars, things like that. They just might need a bit more help with stairs, and for walks they'd probably want to take less lengthy walks. They may get tired faster. You might notice some panting, but that could also just be with older age, and they may just want to stop. So there's a lot of people who have to carry their pets back home when they don't want to walk anymore. I know. Sometimes it's really hard to gauge in cats, but usually they don't really want to play. They might not use their kind of scratching posts, things like that, as often. Hard time jumping onto surfaces if they've normally done that. They may not enjoy you petting them as much, or there may be limited kind of times when you're petting them or being affectionate with them where they're not as happy with you, or like less inclined to want to get attention from you if they're very uncomfortable.
And sometimes they'll spend a lot more time near radiators and sources of heat just to keep warm and relax the bones. Pain in your joints. As you get older, there's always wear and tear, and they will be painful. So these are if you don't want to move around much, you will then gain weight, which is a vicious circle. So you do need to watch that. You need to make sure that that they're staying as fit as they can and a slimmer body weight, because it will make a difference for the joints and keep them going more puppy-like for a longer period of time.
I mean, for what I've done with him, he's been on a weight loss plan, and we also started using some joint support supplements, what I feel like have helped. I mean, he doesn't seem to care that he likes them. They're treats to him.
Older dogs can't do stairs very well.
No.
Well, I think Buddy does. Buddy
now he does.
But Walter, he used to do some crazy things. A few years ago, he can no longer do stairs. He'd walk down a couple of stairs and jump the rest. So stairs are no longer allowed. And so baby gates, which is another thing you use when they're puppies, comes back out when they're older. So you want to make sure that your friend isn't going to hurt themselves.
Adding more surfaces with traction and comfort for your pet. So if there's certain areas in the house that may be tile, you may want to kind of have a carpet, for example, or there's plenty of beds, ones that are easy for them to get up and down from. Also, cutting your pet's nails regularly will help with slipping on surfaces. Yes, it does.
It allows for the little pads to actually make contact. Speaking of pads, because they stick right on, they last for a few days usually, and then they will wear off. They don't cause any pain or discomfort, but they're like little pads, so he doesn't have to wear booties. So if booties are a big, no, not going to do it, these are great. Joint diet is another. They just have special things that help with the different conditions that the older dogs get. There is salmon oils that you can add, fish oils, basically with a lot of omega-3s to reduce the arachidonic cascade, just to reduce the joint pain that is caused by just soft tissue pain?
So most recently with our pets with arthritis, we've been incorporating the use of Solensia and Librela, which are two injectable medications that you can use for arthritis pain in your cats and dogs. So Solensia is for cats and Librela is for dogs. They've been around for about 3 years now, but we've started using it within the last year, and we've seen a lot of owners have a lot of success with it. So it is an injection that you'd give to your pet or bring your pet to the clinic, and we'd give it to your pet every 28 days. Usually we see results within 7 days or so, but they do say it takes about 3 injections or 3 months worth of injections to definitively say if it's helping with your pet. This month in January is our Senior Pets Month, and we do have a offer which is to buy 2 of either the Solensia or Librela and get the third one free. So that also offers you the opportunity to try the full 3 months worth of that medication to see if it really does help with your pet's arthritis.
Cognitive decline can be hard to actually recognize, especially at first. The signs that you will often see is they kind of stop and stare and do that for an extended period of time. And if they're going deaf as well, which is also a thing, it's going to take a long time to get their attention. Just and also being aware of different places in the home that can be confusing. Walter sometimes can get lost in a corner and can't find his way out. Yeah, they just seem more lost, which is, it's heartbreaking to see, but there are things that we can do. There are different diets that can be very useful. They've got a lot of diets that are just basically, they target the aging dog. And the brain diet, for example, is one. There are so many different kinds of drugs that we can use for cognitive dysfunction for our canine friends and our feline friends. Selegiline being one of those things. Clomipramine, fluoxetine. They deal with depression, anxiety, and they can be very, very helpful.
As well as cognitive dysfunction, it's nice to not change a lot within the home. Mm-hmm. So if there's like a specific room, we're not changing the layout of everything. It tends to confuse them a little bit. It may stress them out, especially if they don't really have like a routine or if they don't know where things are.
Routine is much, much more important in the older dog. One of the things you want to make sure is that there's nothing wrong. So if there is all of a sudden, my senior pet won't eat, my old dog, my old cat, it's probably a really good time to take them to a veterinarian and get them checked out. Why? Do we have weight loss? Do we have a problem? So many different things do tend to affect the older animal. But old age is not a disease, right?
And sometimes when you notice that there's maybe some more issues with eating or they don't seem as interested in food, there also can be some discomfort with their teeth. And I can say this for myself, we don't really keep up with kind of teeth brushing and stuff like that. So over time it can cause a lot of discomfort within their mouth. So it's definitely important to do regular dental cleanings. We are also making sure that everything in the mouth that we may not be able to see is okay. So for him, he had a dental cleaning and he ended up needing teeth extracted, which I had no idea. But he definitely is eating a lot more comfortable, as you can see. The Animal Hospital of High Park in February, we do have our dental month. So that is definitely a good time if you are interested or you do have concerns with your pet's dental health to come in. We can always kind of assess them from there, and it definitely may be a beneficial time for you to throw in a dental for them.
When you start out with a pet, you will see a veterinarian once a year, as regularly. It's a good idea to see them actually every 6 months. After a certain age, when you start to see the aging, it will help. It will help with everything. Doing
blood work regularly with our older animals, typically they tend to have some changes with liver and kidney function specifically. So it's definitely important to keep up with that and see how that organ function is changing, just because you can't see it based on looking at them. So it's definitely important to regularly check and see how that's kind of trending with them.
Yeah. It's hard to go ahead and see one of your best friends get older, and because you just want them to live long and as long as they possibly can, but comfortably too. So when something happens, there's often a lot of things that you can do, and that's what we need to let you know. We're on there, where you're part of the team to find out and make sure that we can protect all the comforts of life for your best friend, dog, cat, guinea pig, rabbit, rats. We see birds too. There are lots of different things that we can do that can really, really help.
Thank you for watching Between Two Senior Floofs. If you like these videos, please subscribe and hit that thumbs up button, and you'll see more videos like this soon.